Welcome to the Institute of Medicine of Chicago. Hello, my name is Pat Meriwether Argus, and I'm a member of the Board of Governors of the Institute of Medicine of Chicago and co-chair of the IOMC Program Committee. In addition, I'm the Executive Director of Project Patient Care. It is my pleasure to welcome you today to discuss the intersection of education, namely higher education, and community engagement with Rosalind Franklin University. Today's session is the second session in our April program series, addressing health equity through community engagement and partnerships. We have joined together to promote careers in healthcare and share the deeply positive impact the interprofessional clinic has on the community at large. Overall, this type of program at Rosalind Franklin University, I'll refer to it as RFU, provides unique opportunities for interprofessionals to work together to achieve better well-being and healthcare equity. IOMC is deeply committed to addressing the social determinants of health and achieving health equity for all. As we grow in our respective fields, we find that it takes more than one type of professional to have a profound impact on an individual, family, and community. We hope you will come to this same assessment today and at the end of this series with Rosalind Franklin University. And if one of my sons actually is a graduate of Rosalind Franklin University, and it was very unusual because he served in Iraq. He wanted to be a high school teacher, biochem teacher, and he came back from Iraq and said, wow, so much has happened there, and the medics were unbelievable. He started as an EMT, and then he ended up at Rosalind Franklin University. He applied for the PA program, and he now practices in emergency medicine in several hospitals and just loves it. He loves the interprofessional activity that goes on, as well as just the training that he got through RFU. So it takes people from all different walks of life that become part of the healthcare profession, and we want to make sure we're opening it up to everyone. Today's agenda includes a panel discussion. There's a Q&A period and updates on the future programs and speakers as well. It's our pleasure to welcome our panel today. Moderator and session leader, Eric Williams, Dr. Eric Williams, Vice President, RFU Division of Diversity, Equity, and Inclusion. Melissa Chen, Dr. Melissa Chen, Clinical Director, RFU Interprofessional Community Clinic. Dr. Frank Maldonado, Executive Chair, Clinical Science Department, Professor of Medicine. Hector Rasgado Flores, Director, Diversity Outreach Success, Professor of Physiology, Biophysics, Master Teacher, Chair of Inspire Program, Lead Health, Partnership with Mexico. Chad Rubeck, Vice President for Institutional Advancement, and Victor Barragan, student of the Mini Medical School. Today's learning objectives are to associate the role of health, medical, and STEM outreach programs in providing success to healthcare careers to local youth in the North Chicago and Waukegan areas, and the impact of medical pipeline programs are having. Detect the specific changes that are made in curricular and co-curricular development at RFU to address health equity, and to identify the clinical outreach efforts and the impact that those efforts are having at the local community. This program is accredited by Rush University and affiliated associations. You will be able to obtain your continuing education credit at the end of the program. Our speakers have completed their conflict of financial disclosures, and this information is on file. On behalf of the Board of Governors, it is my pleasure to warmly welcome everyone today. We are honored with your overall support of IOMC. If you are visiting IOMC for the first time, we conduct monthly virtual sessions except during the summer months of July and August. There are numerous opportunities to be engaged with IOMC. In the fall, we expect to begin our work groups, so please stay tuned for more information. IOMC is celebrating our 106th year, and in June, we will have reached our 107th year as an organization. IOMC is an independent, not-for-profit organization of distinguished leaders in the health field who collaborate to improve the health of the public. We are proud to draw upon the membership diversity that we have and other regional leaders to address critical health issues. In addition to today's session, additional complimentary sessions will be held on April 22nd and 29th. And these also are with Rosalind Franklin University. Also on May 6th, we are addressing chronic kidney disease systemic issues impacting health equity. And again, with a great lineup of speakers that are leaders in this field. In June, IOMC will hold its 2020-22 annual meeting and IOMC Healthcare Awards. The 2022 IOMC Healthcare Awards are open for nominations now. There are 7 award opportunities. The deadlines are May 2nd to the 4th for specific award types. Please consider nominating a colleague or an organization this year. The awards will be presented at the annual meeting. At this time, I would like to introduce Dr. Eric Williams, who will moderate this upcoming session. Dr. Williams joined Rosalind Franklin University of Medicine and Science in August 2021 as the inaugural Vice President for Diversity, Equity, and Inclusion. In this role, he guides the development and implementation of a proactive diversity, equity, inclusion, and community engagement vision that supports the mission and vision of RFU and its commitment to health equity. Dr. Williams, welcome to IOMC, and thank you for being with us today.
Thank you so much for that introduction, Pat. Before we get started, I do want to add a little bit to Victor's bio as well. Victor is actually a second-year medical student in the Chicago Medical School here at Rosalind Franklin University. He also serves as the president of his class and executive chair of the Inspire program and Science Saturdays and the Mini Medical School. Today, here at Rosalind Franklin University, we want to talk about what impact are we having here within our community, especially our immediate communities of North Chicago, Waukegan, and other parts of Lake County. Quite often when we think of Lake County, we think of some of the other areas of Lake County, but we have quite a few diverse pockets here within Lake County, especially in North Chicago, Waukegan. We get to Zion and Antioch as well. And so today we want to talk about how do we address health equity through our educational opportunities, outreach, and our partnerships. Those are clinical and community and corporate partnerships. And before we actually get into the presentation, I do want to say thank you to Pat's son, who served in Iraq. As a veteran, I really appreciate the work of our medics in the Marine Corps and Army medics, the Army medics and the Air Force medics, but also our Navy corpsmen as well. And the PA program actually got its beginnings through the military. And so we really appreciate coming back and serving and coming back and continue to serve as a physician assistant. Today, we're going to address health equity, and I have a distinguished panel of my colleagues here from Rosalind Franklin University. And so what we're going to do is get right into what we come here to do. And like Pat was talking about, our objectives is to increase diversity at Rosalind Franklin University. Well, this is going to be actually Frank's, Hector's presentation right here. So we're going to get right into, we're going to start with Victor. Victor Barragan, he's going to talk about our mini medical school. There you go, Victor.
Hello, and thank you so much for having me. Like Dr. Williams said, thank you for the introduction. I'm a second year medical student, and I am the executive chair for the mini medical school, which launched this year. And I think such a wonderful program. But before I tell you a little bit about that, from a medical student perspective, I wanted just to tell you guys that all of these education outreach programs that start at the fourth grade level, reaching out into the community, these are the kinds of things that helped me come to medical school, because I shouldn't be here. Coming from the background that I was, it's virtually impossible, and education makes it possible. So all of these programs are examples of Rosalind Franklin University reaching out to the community and not just talking the talk, but actually walking the walk. And there's a lot of programming that reaches out to students interested in medicine that normally wouldn't have these great opportunities. And we start with the mini medical school. And the mini medical school is a wonderful program that we inaugurated this year. And with the help of Dr. Chatterjee, Dr. Olivier, and the support that the executive committee was given to us. And it's just another wonderful program that Rosalind Franklin University has. And sorry, I keep saying that because I really passionate about these programs because they're so wonderful. Now, what we want to do is say that with the mini medical school, we partner with the North Chicago community partners, and we selected an elementary school, and we identified fourth grade students that are interested in medicine and science or STEM programs. And what we did is we had to run it virtually, but what we do with the program is we present a white coat ceremony at the beginning of it. So we kind of simulate medical school for them. Then we go run through the curriculum, which includes running through the body systems at an organ system level. It's not too intense for the fourth grade level, but what we do is, I'll give you an example. We started with the MSK, which is the musculoskeletal system. And what we did is we gave them an introduction. This is the system, this is the body system, right? What happens when you pull a muscle, right? What happens when you get tired? The next system was the respiratory system, for example. And what we did in a virtual way is we started with an introduction, where all the organs are, and what we were able to do with the North Community partners and with Rosalind Franklin University and all of our fantastic donors, I don't know all of them, but we were able to send supplies to the students. So as I'm teaching them anatomy, they have this cute little anatomy body that's called the squishy body. And all of the students, I wish I could show you photos, all of the students were super excited because I would be giving the pulmonary lecture, and I would say, okay, look, feel the thoracic cage, which is the bones or your ribs as we know it. And then see how the lungs are super, super sensitive underneath. The function of that is to protect them. And that's why when you hurt your ribs, that could be potentially dangerous. Or we talked about how the lungs are super important, and we talked about, pathology at a very introductory level. So we talked about the reasons why smoking is not good, or the reasons why your heart rate goes up if you do jumping jacks. And then we had them calculate their heart rate before and after doing jumping jacks, and they were able to see how their body works in a very, very real way. And again, Rosalind Franklin University provides us the creative freedom as medical students to launch these programs. And I think that that's why they work so well. And you'll hear from the other panelists as well, but students are given a lot of creative freedom to run the programs. And I think that students really respond well to the programs that people care about, because one of the feedback that we get from the mini medical students are, oh my gosh, you look like my older brother, or you look like my sister, or like, how old are you? Someone asked me, and I was like, oh, you don't want to know. but the relativity and the proximity to them really, really matters. And I think it is just such a wonderful opportunity for the students. And then we had a graduation. Administration within the Chicago Medical School came, supported, they saw the medical students in action. And not only are we allowing the community to be a part of the university that is sitting in their backyard, we're bridging that gap that the community doesn't necessarily sometimes know that there's a medical school in their backyard. By bridging that gap and having these students be interacting with Rosalind Franklin University is one of the best ways to kind of even show, hey, there's a med school right here. Let's have you come, let's have you be interested in medicine. And also what I think that programs like these do is, I'm very aware of healthcare inequities, but what it does is my colleagues who may not necessarily be aware of a lot of these inequities are actually exposed to them in a very, very real firsthand way. And not only are the students learning and getting opportunities, but our medical students and our students at our RFU, Rosalind Franklin University, they're getting real firsthand, genuine exposure to the community. And that's invaluable. That's something that you can't learn in a Zoom call, that you can't learn in a classroom. When you interact with students in the community, you're left with the best education that you can get. And it's both for the students and for us as medical students as well.
Thank you, Victor. That was excellent. And we got a chance to see how important, putting people in front of our children who look like them and can serve as role models for the up and coming healthcare professionals. And so we're going to continue on with our conversation about, excuse me, my alarm went off, but our conversation about our pipeline programs, our path, or what we like to call also our pathways programs. And so I'd like to introduce Dr. Hector Moscato Flores.
Thank you very much, Dr. Williams. It's quite a pleasure and a privilege to be here. Our university is located in North Chicago. And North Chicago has about 70% population of underrepresented in medicine. We are neighbors to Waukegan, where the population is even larger, 80% underrepresented. Now, if you ask us, we have been in North Chicago for 40 years, Rosalind Franklin. Now, if you ask us how many graduates we have produced from North Chicago, we are going to be embarrassed to answer very few, if any. And how many have we graduated from Waukegan? We are beginning to graduate, and this year will be the first year that we graduate and a student in medical school coming from Waukegan. It's historic, and we are delighted. And there are 5 more students already on the pipeline to graduate in medical school. So this is something that is certainly a problem, and our university recognizes that's a problem. And there are many reasons why we haven't been able to be a vibrant component of our community, graduating, educating its youth. So we want to break that barrier. We want to make that happen. And that's why we have created all these programs. The new program is Mini Medical School, just started. Victor did, as all the things he does, fantastic work. But we have several other programs. We have 5 more programs. One is called Science Saturdays, Inspire, the pre-matriculation program, peer tutoring, and the individualized strategic enhancement program. Because we want to bring the students, but what is the point of bringing them if they are going to be struggling? We want them to be very successful and to develop their potential to the maximum. The next slide, please. It tells us about the program that's called Science Saturdays. This program is a free program. It's for high school students that are local students. We provide transportation to the students to come for 10 Saturdays to work with us. They come for 4 hours. We give them lunch, and we give them an exam when they come. And you can see they get 15% of them get correct answers when they arrive. But after the 10 weeks, 89% of them get correct answers. So this is a very important improvement. We take 32 students per session, and we do this. This has been so popular that we are doing this now 2 times per year. Next slide. So what we do then from these students, that about 60 students per year, we select the ones that we find that are the most committed and that the family are supportive to the students. And we invite them to participate in another program that is a very ambitious program. It's called Inspire. This program, we have been running it for 11 years now. And the idea of this program is to provide to these high school students with scientific hands-on training on science. We pair them with graduate students, medical students, and faculty that are doing research of the highest quality in the world. That's the research we do at the university. They do hands-on research for 2 months. Now, to make this happen, the students, the inspired students, have to have a salary. Otherwise, they would go to work in a fast food chain for very likely. So to protect their time and their commitment, we give them a salary, and that's critical. And university provides the in-kind support for this program to work. Next one, please. How does Inspire works? Well, it's very successful. 100% of the Inspire students improve their ACT, and that's almost twice as many as the national average. 100% of the students graduate from high school. That's 40% higher than North Chicago and 25% higher than Waukegan. 100% of our students go to college, and that's twice as many as their peers not coming to the program. And 62%, 63% of them go to STEM. That's 8 times larger than their peers. So it's a very successful program. We're very proud of the program. And now the problem we are facing, and I can say this very openly, is that students that graduate from college, they are still not coming to higher education. And there are many reasons that we are trying to break now, and they have economic barriers. They have lack of models. They are the first in their families to go to college. So they don't see anybody going to even to get a master's or a doctorate. And of course, doing that would change their lives even further, and because they would be developing their potential to the fullest. Next slide. So we have Science Saturdays, then they go to Inspire, and now we want them to come to graduate school, especially to the Chicago Medical School. But there are other options, of course. We have a new program of nursing that we want them to go as well, and physician assistants and podiatry. We have over 20 careers at our university. But for the case of the Chicago Medical School, there is a program that's called pre-matriculation program. And these students, please let the next slide, what we do, we provide them with training, and we provide them with support to present the MCAT, the exam for admission to the medical school. And these students enter to the medical school, and they become very successful, and they are able to attain the specialties of their choice. If we can see the next slide. Okay, so all this put together is what is creating the pathway for our community students being educated to the level of attaining higher education with us. Thank you.
All right, thank you, Dr. Roscato. Now, you just had the opportunity to learn about some of our pathways and how we look at health equity through educational opportunities and developing that pathway or developing talent for students to go into the healthcare field. But now, what is Rosalind Franklin doing out in the community to address health equity as far as providing direct care? And now we bring to the panel Dr. Melissa Chen, who's going to talk about our interprofessional community clinic. Dr. Chen?
Thank you. Thank you for this opportunity to share the work of our campus student-led free clinic with the greater community. The students have been doing some tremendous work. So I am an internist. I'm an associate professor at Chicago Medical School, where I'm developing and teaching a longitudinal course on health equity, and the faculty director of this clinic. Next slide, please. So the ICC was started by students almost 10 years ago for a two-part mission. First and foremost, to provide accessible quality healthcare for the uninsured of our community, and also to provide an opportunity for students to work with our communities, develop interprofessional communication and teamwork skills with an intentional emphasis on principles of equity. Next slide, please. We've had about 4,000 patient visits across 4 services, medicine, podiatry, physical therapy, and behavioral health, which also includes health behavior change counseling. Our average patient is a 40-something-year-old Spanish-speaking Latina with hypertension, obesity, diabetes, and musculoskeletal pain. Next slide, please. Our work has to be for and centered in the community. None of us should think we know everything about what is best for our patients. With collaboration, we get better solutions for our patients, and the students get a better education out of it. They learn things like developing educational materials is not a one-way paternalistic delivery of information. It is a collaboration. What do the people want to learn about? And what kind of language is actually effective in communicating this concept? So here on the slide are some of our community collaborations that the ICC students have fostered this year. I'll highlight a few of them. With the North Chicago think tank, we've developed approaches to the community that demystify health concepts. We're also doing things like figuring out ways to reach patients who don't have a lot of digital access or literacy, challenging in the midst of a pandemic. With the Lake County Health Department, students had developed handouts in conjunction with community health workers about COVID-19. With the help of Equal Hope, we developed an empathetic inquiry training for our student care coordinators to learn to ask screening questions about the social determinants of health in a sensitive, trauma-informed manner. And with the Waukegan Public Library, their community health worker training program, we're developing workshop opportunities for community health workers and our students for them to have the conversations that enable us to start overcoming biases. Next slide, please. With every one of these collaborations, students are learning it's not just about outreach, it's about two-way conversations and teamwork to develop truly effective solutions. And these conversations are happening with teams of students representing many different health profession fields, with everyone lending a hand in their particular scope of practice and learning what the other fields can do in these community collaborations, which is real life experience preparing them for a future of interprofessional collaboration in the community. Next slide, please. So these are just a few ways that the ICC is addressing health equity through community partnerships. It is a singular educational experience for students and faculty too. Not only are we developing skills for clinical practice, but also in number one, interprofessionalism. Number two, gaining experience in creating systems change. They are learning how inequities can be embedded in clinic processes and making the changes needed for health equity. And finally, they are learning through intentional, constructive alliances with the community, which promotes understanding to overcome biases and ultimately expands healthcare access and the understanding of what that means. They are learning social accountability and what it truly means to center the communities that we serve.
Thank you, Dr. Chan. I really appreciate your insights on the ICC and informing our community what the ICC is doing within especially the North Chicago and Waukegan communities. Not only do we work within our community to address health equity, but we have to develop, partnerships. And please don't pay attention to that particular slide. We're not at the end of the presentation quite yet, but you can ask questions in the chat area as we go along. But as some of you may know, Rosalind Franklin University is not truly associated with one particular hospital, but we've developed some clinical partnerships. And so we're going to have Dr. Frank Maldonado talk about what some of those clinical partnerships are and what we are doing with those partnerships. Dr. Maldonado?
Sorry about that. So thank you, Eric. I want to first thank IMC for giving us the opportunity to present our programs. As executive chair of the clinical science, I deal mostly with the clinical years, the third and fourth year. And we work very closely, like Eric said, with multiple partners in the community. We have over 27 different affiliated hospitals that our students rotate through, some of them even out of state. So, but I want to really focus on two specific partnerships that we have developed during the years that I think are of tremendous importance. The first one is with the Lake County Health Department. The Lake County Health Department has actually, served as a great place for our students to learn about diversity, equity, and inclusion. We presently have third-year students that go there for clerkships in pediatrics and family medicine. It's a great experience for them to learn exactly what's really going on in the community. We partner with other schools within the university, podiatry, pharmacy, nursing. So we all go there as an interdisciplinary team, not only to learn, but to provide care. We, some of our students have done some amazing, not only educational experiences, but, research. I mean, they work very closely with the epidemiologists at the Lake County Health Department, and they have done some marvelous publications. The other important thing is that we provide also postgraduate education to the community. So in other words, not only do we work with medical students, but we also work with residents. We have 2 major residencies in internal medicine and psychiatry with multiple fellowships. Our residents actually rotate to the Lake County Public Health Department. And let me tell you, they really enjoy it. They really get to know the community. They really get to be part of that community. And our whole goal is like starting with Victor's mini medical school, with Melissa and all of the medical school, have them complete medical school. Stay in the area. We offer residency, we offer fellowships, and then actually have them stay in the area as healthcare professionals. So we're really striving to see that continuum of education resulting in improvement into our community. The other collaboration that I wanted to talk about, because that's where we're starting to see a lot of this integrated community, is with the Great Lakes Naval Base. I don't know if many of you know that the Great Lakes Naval Base is here located in North Chicago, is the only basic training center for the U.S. Navy. In other words, if you're going to join the U.S. Navy, you have to come through Great Lakes. We receive about 45,000 recruits a year. Those recruits, about a third of them, actually go to further school, submarine, aviation, nuclear medicine, etc. And about the rest actually go to the ships, mostly in the West Coast where they get deployed. Not only that, so we have an affiliation with the Lovell Federal Healthcare Center. The Lovell Federal Healthcare Center is actually an integrated facility between the Department of Defense and the Veterans Affairs. It's the only integrated, fully integrated healthcare facility. I spent 30 years of my life at that place. I recently retired, joined the school. But I can tell you that I am deeply involved, and we are deeply involved with that institution. We have not only medical students all the way from first year all the way to senior year that rotate through the Federal Healthcare Center. And not only they go there for education, they have been instrumental in helping that institution in times of despair. COVID hit the Federal Healthcare Center pretty hard. Not only so, what the students actually did, they developed an information center within the hospital that actually was manned by students and was open not only to the veterans and to the military, but was open to all of the community. They received all these phone calls. They educated them on vaccination, educated them on resources and the disease. And I got 1 minute. So one of the things that I want to emphasize is this year we have seen 4 of our medical students actually accepted for psychiatry residency at our program. So that means that they will be doing residency, training within our program. This year, the Federal Healthcare Center actually hired 4 residents that were graduated from our own program. So we're starting to see that flow between medical school to residency to staying in the community as provider, which is what we really are pushing for. Thank you for the time.
Thank you, Dr. Maldonado. And on a personal note, I really appreciate the services that the Integrated Healthcare Center actually has, because I, as a veteran, I actually use some of those services over there as well. And on another personal note, my grandfather, who was a World War II veteran, actually did his basic training. He served in the Navy in World War II. He did his training at Great Lakes. So that's on a personal note. Now, of course, we have our clinical partnerships that Dr. Maldonado just spoke about. But we also, when we look at providing opportunities for not only our students at Rosalind Franklin University, but also for some of the building the pipeline of students to be able to be successful in medical and healthcare education, we have to look at our community and corporate partnerships. Okay, and so I want to bring to you all Chad Rubik, who's going to talk about some of those partnerships we have with our corporate partners.
Thank you. So it's about the needs we meet, not the needs we have. As a university community that is centered on the community, I want to repeat that. It's about the needs we meet, not the needs we have. What that means is that we absolutely are working to understand the needs of the community, and then working collaboratively with groups of people and special interests to address those interests that affect the well-being of that community and the people who live in it. It's interesting to understand too the context of Lake County. Lake County is the wealthiest county in the state of Illinois. And yet 1/3 of our county is considered, the communities in our county are considered high economic hardship communities. It's areas with high racial disparity and low educational attainment. So while we live in a space that has the highest wealth, we also understand that there is a great community need that we need to be very intentional about addressing. You heard my colleagues talking about the intentionality of that pathway and pipeline programs, where we're working with children in the community to address their curiosity, to kindle that fire to learn, while also in doing so, helping to grow health literacy amongst our region's children. That is the greatest way we're going to have this health impact, is addressing their health literacy. But what I also want you to hear is the opportunities that Dr. Chen had mentioned about the mobile clinic and our mobile care team. For example, a few years ago when the pandemic really went live and started making a great impact in our region, one of our community funding partners, the Staines Foundation, challenged us. They knew we were no longer going to be able to have in-person STEM education programs, Science Saturdays and Inspire. So how were we going to reallocate the resources that they had provided to have an impact on the education system? We worked collaboratively with the North Chicago School District and the Learn Academies to provide COVID testing to the educators, to the administrators, and others to ensure that our children had a healthy and safe learning space. We also worked with those partners as trusted public health educators, because we found that there was a great deal of vaccine resistance and hesitancy within those communities. So how are we able to be partners in a public health crisis? I also want to acknowledge the work of our Center for Health Equity Research and the mobile clinic and our lifestyle medicine as we seek to understand the needs and address those community needs, even within the STEM education program. For example, in this region, there is a high incidence of asthma in the community. Asthma mobile clinics were found nationally to represent about a 66% decline in emergency department visits. And impactfully, it also had an impact of 78% decline in 5 days or fewer missed school days per child. Now, it's interesting to think about that from an asthma standpoint and the health of the community. That child who has asthma might be treated within the community, within our mobile care coach and other places, but because they live in an area of poverty, it's likely that they're going back into homes that have molds that trigger the very asthma that they have. So how are we helping to address those community health needs, the health navigators, the public health issues to address that asthmatic child who is not able to learn in the classroom? Those other children in the region who are living in an urban food desert and lack the nourishment to stay focused in the classroom. We referenced also the need for scholarships to provide resources of support to address those economic barriers for the children. But it's also important to show that those jobs that Dr. Roscato had mentioned, those children have an economic need, economic burden and responsibility in their families as well. So it's not just about scholarship that creates access to education. It's about jobs that help them matriculate through and continue to be parts of their community, parts of their family. In other words, it's those other social determinants of health that are really having an impact in this region. If we look at this, health equity is a system-wide challenge, and we're thrilled to be a part of a high-impact coalition in this region, a partnership of industry, education, public health, healthcare, elected officials, community interest groups, and philanthropic partners in this coalition of trust, some of whom are on the call today. Michael Reese Foundation, supporting our health equity research, North Shore in partnership with our community care connection and bringing the mobile clinic out, Washington Square Foundation and others that are partnering to give us the learning resources that our students need so that they can also translate that into our children's community and to their education. Finally, I want to leave you with this. A few years ago, our President Rowe, invited several of us to read this book called Compassionomics. Compassionomics is essentially a critical part of what you all as physicians and we all as the support team are meant to do, have in giving back to our patients. But it demonstrates, this publication demonstrates the difference between empathy and compassion. Empathy is feeling and compassion is healing. And by that we show empathy is understanding the plight, the needs of these children in this region. Empathy is feeling that, and that's a higher level of thinking to be understanding of that need. But compassion moves things to action. Compassion says, I understand that that child is hungry, but how are we going to address the urban food desert? I understand that child has educational needs. How are we going to build a coalition of support to be very intentional about every aspect of that pathway? Compassion is what we're trying to build, a high impact, compassionate coalition to address these community needs. And we're thrilled to be partners with you in addressing the Chicagoland and the northern area of Lake County's regional needs. Thank you.
Thank you, Chad, and what a way to bring it all home for us. You know, today you all had an opportunity to listen to what Rosalind Franklin University is doing within our community, from providing pathways to a medical education for our local community students, especially those who are from high need areas in our North Chicago area, Waukegan areas, to how we provide care within our community. And those partnerships that we've developed, whether it's with our local VA and Department of Defense, hospital and clinics, to what we're doing with other partners, and looking at our corporate and community partnerships as well. And so we just want to thank you for giving us this opportunity to letting us share what we're doing at Rosalind Franklin University. And I know there may be some questions out there, and so if there are any questions, I think you can type them in the chat area. And I see Pat is ready to come back on as well.
Yes, and I can't thank you and your team of clinicians, compassionomic believers in what they're doing, because it really is making a huge difference. I look at the different programs that you have, and I know there's a question out there from Steve Andes asking about, can you give an example of how community input changes have shaped your program?
I can address that question as an initial approach.
Okay, we're gonna let Hector and Melissa address that question. Okay, so Melissa, you're on after Hector. Okay.
Oh, sorry. Yes.
Go ahead.
Go ahead. Go ahead,
Okay,
Steve.
very good. All right. Well, from our pipeline programs, let me tell you, was this question whether we should continue with Inspire and Sun Saturdays during the COVID years. And we decided to continue, and we found the way to do it because we found a laboratory system that we could use online. And the program not only continued, but flourished and got enhanced. That was quite remarkable. And the reason it happened like that was for two reasons. One is the commitment of the TAs and the students like Victor, who made very, very clear that they wanted the program to succeed. They invested the time and the enthusiasm to make that work. And the second, and that has to do with this question, was the involvement with the parents, the involvement with the families. That's absolutely critical. We communicated with the families at the beginning of the courses, midway, and at the end of the courses, so that the families really understood what we were trying to do with the students, and they provided the support that the students require to make a successful journey through these pathways. So we got the feedback from the families at every step, and that's the only way that the program was successful. I happen to be in the board of another big program that's millions of dollars from the National Science Foundation, and that program was almost halted. That's for another big university in Chicago, because they didn't do that. They didn't communicate with the parents and the families. So that's very, very important, critical feedback.
Community input has really transformed the ICC and its approach to delivering healthcare in our community. You know, when I first joined, it started with I would get input, from passionate students who said, "Hey, I want to teach about this subject, and here's a 50-slide PowerPoint presentation." And I was like, "Whoa, we need some input. Is that going to be the most successful way to deliver this message?" So it's really transformed the way we approach delivering health literacy and information about education about health concepts. But also we believe that it really needs to be, they really need to be in the room where it happens, right? So we've been working a lot with William Coleman, who's a community health worker and also the founder of the North Chicago think tank, which is, he's a North Chicago resident who left and came back and said, "Hey, why do I need to leave and come back to be successful? Why can't we build up North Chicago to be successful with the strengths of our community?" So William Coleman is now on the first community member to be part of a board of one of the RFU organizations, and he is helping us just on the ground instrumentally with educating our students and influencing the way we approach health. And I see Victor has a hand up, and also I see Pat's comment, but I can also speak to the telehealth real briefly. The ICC has been entirely telehealth for the last couple of years, and so it has definitely it's definitely been a change in the way we approach medicine. Telehealth has been a boon for a certain segment of our population for whom transportation has been a problem, but it continues to be a challenge for other parts of our population for whom digital access continues to be a problem. So some of our community collaborations, like with Sano Health, provides cell phones and cell service to those who don't have it, and developing a telehubs program where there's a safe space for community members to have a telehealth visit in a safe library or other safe place with good Wi-Fi access.
Go ahead, Victor.
I just wanted to address the first question of getting feedback. One of the things, and this may seem trivial at first, but it's actually allowed the programs to become more strengthened. And one of the feedback that we have taken from students is the mentorship of students that are from more diverse backgrounds. Because initially, I think the programs were picked off and there were only graduate students, or there were only this or only that, or there was only one type of student. And ever since, and Dr. Rodescado and all of the professors can attest to this that are on the Inspire program, have seen that the students have responded much better and it's much more resounding when we pair them with students that are interested not only in what they are interested in, but also come from a similar background and can kind of say, I know what you're going through. And I think that even though it seems small and trivial to kind of mentor someone with like a similar background or similar interests, it actually makes a world of difference, because then I think the students become more inspired to complete the program and to be more passionate and to think that they can also do it. And I think that I know that it's a little trivial, but the little details of planning it are super important. And if I can go into the other one to get started, I would say find people that really care about the programs. That's what's going to get you the best output.
Okay, can we have Chad, then Frank?
Thank you. Let me address a couple of those things in terms of community needs assessment and where do we get this information. There's a couple opportunities. The Healthcare Foundation of Northern Lake County on a regular basis produces a community health needs assessment, and then identifies in there the high incidence of diabetes and asthma and obesity and other factors. That also identifies some of the environmental areas that exist here, as well as some of the social determinants of health, lack of transportation, lack of access, the language barriers that exist in the region. A lot of those things are kind of built and shaped by this community health needs assessment. It isn't for us to make this up, it's for us to work in partnership with the community to address these. Now, additionally, we have a lot of, as you heard here, a lot of ears on the ground, so to speak, working with the Mano y Manos, working with the community foundations and the school districts and the others, so that we understand their specific needs and where we might be leveraged partners there. Let me address then the question on getting things started. I'm in about 20 years of working on STEM education. Prior to Rosalind Franklin, I spent 17 years at the University of Iowa building a STEM education program that has become one of the national models for statewide outreach around STEM education. And I can tell you over and again, the best opportunity is sitting down with the education programs and understanding what their specific needs are. The school district that has a science educator that is wonderful in physics, but needs to bring that together in coalition, us being able to bring them at the University of Iowa into hyperbaric medicine and seeing how that hyperbaric medicine in the chamber uses applied physics to address wound healing, to address other ailments that are impacting our community. What we can do is not deliver ourselves into the community as, again, whatever we have to offer. Our best thing is to understand their needs, what their opportunities are, and where we can be leveraged partners. Victor was right on. Our students are passionate about this. They need to be great role models back into the community. So if we can understand what those community needs are, have that active conversation within the community, and then leverage our strength, we're going to have a great deal more reach than we can if we're just focused on bringing 30 students into the classroom. But even as Dr. Chen mentioned, if those students, if we're delivering some things in a digital platform, if those students don't have access to internet and they don't have access to safe libraries in which to learn, we can't deploy that information to those learning communities and to those after-school programs and others. So again, it has to be a high impact coalition that is built around the system of change, not just one program and function.
I was going to add something to that, but you covered all of that answer. Thank you, Chad. Dr. Maldonado.
Just quickly, I just want to add to the question about technology and telehealth. So technology, like Chad said, has helped us tremendously with education into the community. Mano a Mano is a local organization that actually, their main goal is to help the non-English speaking Spanish population. I have done several meetings with them, especially during the COVID. I mean, and we went through a Facebook Live, give a little bit introduction, open up for a lot of questions, and you would be amazed of what the community needs regarding education. So not only for healthcare, it's helping us, I know the Federal Healthcare Center as a VA has been, a lead in, in healthcare for many, many years. Everything exploded with COVID, as we all know, and our students are and residents and fellows, they're just tremendously, benefit from that exposure. Regarding the community outcome, well, thank you for someone who said that disease management and disease prevention are long-term outcomes, no question about it. But I think that we are very lucky that at the Lake County Health Department, their medical director, Dr. Les Zong, he's been in our faculty for many, many years. Les is an educator, is a researcher. It's a great person to work with. We're in the talks of, publications, monitoring this. So not only from the educational perspective of how we are creating change in the community. Thank you.
Thank you, Frank. I think it is time for us to turn it over to Pat.
Well, and I'd like to ask if there are any closing remarks before I close out. Anything you want to add, Dr. Williams?
I think our panelists covered everything. So thank you so much for allowing us this opportunity to speak with the IOMC and other members of the community. We really appreciate this opportunity. Thank you so much.
Well, I want to congratulate you and thank you also for all that you've given to so many, to close those gaps. And what I love too is how you approach it. It's not about the needs of RFU, but the needs of others. And again, that really drives the passion and commitment you have for your communities, for the students in your communities, as well as the students that are at RFU. This has been a wonderful and inspiring program. I wish it was replicated, the programs you have replicated throughout the US, and I suspect we wouldn't have as many healthcare issues as we do. Thank you so much. And again, the speakers, everyone, for your insights and experience that you've shared today. We want to remind everyone of the IOMC Healthcare Awards. The closing deadline is May 2 to 4 for all submittals. Please see the IOMC website for more information. That's www.iomc.org. Thank you for attending today. We hope to see you at the third virtual session on April 22nd with RFU on leveraging the power of research to improve community health and wellness. Please follow us on LinkedIn, check out our blog, and visit the IOMC website. And most of all, also have a great day and a great weekend. And thank you all for your leadership.